Dr. Fenderson, let's talk about periodontal disease. Now, here's what I hear many dentists always saying, and that is if you don't fix your periodontal disease, your gum disease, basically, same thing, starting with gingivitis and kind of, getting further and further and becoming full-blown heavy gum disease, which is basically an infection in the mouth. It's kind of that yellow, reddish, ugly pus which you get when you cut yourself and you don't take care of it and it gets infected. You have that in the mouth, and it eats away at the flesh around your teeth, which is the gums. And by doing so, it eats away the bones, and you start losing your teeth. And we talked a lot about what that does. So, however, let me ask you, if that's the case, and this takes usually years, 2, 3, 5, maybe even 10 years for it to really happening, and the tooth loss is bad because, it's bad, and always way, however, you guys do a good job replacing them. You have implants, you have crowns, we can replace them. So it's not the end of the world, even though expensive, and while it's happening, your mouth stinks probably and all kinds of stuff. But while this is happening, wouldn't this infection infect your body? Wouldn't, the mouth is the gateway to the blood vessels. We know that if we take salt or anything under the tongue, it goes boom to the blood vessels and we get a jolt. So wouldn't the infection there do the same? It would go into the blood and poison your body hour by hour, the kidney, the liver, your whole immune system, obviously the heart, the brain, and wouldn't that be even worse than the tooth loss, which, yes, they can be replaced. We're not living anymore in the time where, I think it was George Washington who had a wooden tooth, maybe not. That must have been ugly and awful. But so you can replace it, but all that other shit which is happening in between, wouldn't that be very devastating to a person's overall health?
You hit it right on. I actually have done lecture series on this, so this is right down my alley. If on my website, napadentist.com, www.napadentist.com, under a little section that has resources, I have a slide presentation in there that talks about all the damage that can go on in your body because of a low grade or a big infection in your mouth. And the problem with infections in your mouth is there's never a lot of pain. You can have actually pus coming out and bad taste and never pain. And yet if you had that type of infection on your arm and that saw pus coming out, you'd run to the doctor and get it fixed. The damage that it causes...
I've heard that, sorry to interrupt you, I've heard that a gum infection, if it's, nicely, decently advanced, if you would put it on your hand, it's as big as your palm, and it would all be infected. Who would not run to the doctor? We're running to the doctor when we have a little infection between our toes, called fungus or whatever it is. It's all the same stuff, but we're not doing it when it's all in the mouth. And apparently all of us, not all of us, but most of us people are simply, when it comes to that, ignorant, I guess.
And yet I've just read in Wall Street Journal, I've read in regular health magazines, and they are starting to explain and tell people more and more that gum disease increases your chance of heart disease. I'm going to get a little fancy because you're going to hear this word C-reactive protein. You'll hear that from your doctor. It is a chemical that is produced and that can cause hardening of the arteries or lay down a plaque in your arteries and everything that comes from that. Stroke. They've actually even related it to on mothers that are pregnant. They can have an early birth, a preterm birth. So
underweight babies, underweight babies, right?
That's right, underweight babies. And they're even related it to some type of pancreatic cancer. I saw an article in the one of the journals the other day that they found that people that have increased gum disease and don't take care of it can have all types of body functions. So you hit the nail right on the head. I think it's more important to get your gums healed up for the sake of your body, let alone your teeth. Like you say, you can always, if your teeth are all lost, you can still live because we can give you something to chew on. Or you can just mush your food and you can still live. However, if your gum disease starts affecting your arteries, your heart, your lungs, COPD, and stroke and brain, that can kill you. That's
right.
That's why it's so important.
Well, there was a lady, in fact, since you are in California, and so am I, there was a lady in California, I think it's only one case, but nevertheless, which she had a stillborn baby, and they found the gum infection in her placenta.
There's no question, because that has been related, and for years it's been suspected. But now they've done some double-blind research study on it, and actually took someone, measured the buildup of plaque in their arteries, in their carotid arteries, through sonograms, and then put them on a regimen cleaning up their gum disease completely. Maybe their diet slightly, but mostly cleaning up their gum disease, and they've actually seen it get better. When they did that, that's when the article started hitting all the magazines, all the papers. They're saying, wow, now there's proof. It was suspected before, but now there's proof that advanced gum disease can really affect your arterial system and hurt you.
Right. Well, in Japan, they made a test in one of those universities, and, people who have the HIV virus and also have gum disease are absolutely more apt to get than the full-blown AIDS. Because you can have HIV virus, like I think this baseball player or basketball player has, and you're not getting the AIDS. Now, thanks God, most people don't have the HIV virus, but if it does something so severe, like a stillborn baby and turning HIV virus into AIDS, what does it do to the normal everyday flu?
Yes.
Because you have all those soldiers going to this one area in your mouth, trying to keep it, clean and trying to fight the infection. So there's no more room for your internal immune system to work for the cold and for the flu and for whatever other shit may come up.
Well, you're talking about the HIV virus, and I have patients that are HIV positive that have not got AIDS, and I talk to them all the time because their immune system, their ability to fight bacteria, the ability to fight some of the infections is so reduced, and that's what causes most of the problems in HIV and then turns to AIDS. Because of that, I say they are very susceptible to it, and we talk to them, and most of them, because they know they can live now most of their life with it, are really responding nicely and keeping their gums very healthy.
Well, it seems to be one of the areas in the body where we have infections, where we easily get an infection for whatever goddamn reason, doesn't really matter, and we better fix it. Well, you mentioned in another video your father-in-law, who is 106 years old, hasn't lost a tooth, obviously has good gums, and taken care by you for the last 40-some years, lucky son of a gun, I wouldn't doubt a little bit that his high age, not everything, but has a lot to do with not having an infection in the mouth.
I suspect that. Yes, he has aging problems. His eyes aren't as good as they do, and he wears hearing aids. But his blood health has been excellent, just excellent. We're excited about it. Here he is at over 100, and he's going to baseball games with us, and went out and cut his Christmas tree with us last weekend. He had the saw. He was cutting the tree. He gets tired. He has the effects of a 100-year-old, but his mouth is healthy, and I agree with you. I think there's probably a big relationship between the mouth and the body, and it will help. I don't know if not. Again, there's genetics, everything about how to live to 100, sure. But I believe that is one of the factors in there that says if you want to live to be a great age and play with your great-grandchildren, then take care of your mouth.
Wonderful. Well, you actually, frankly, instilled new desire in me to go and see my dentist a little bit more often, because I'm one of those guys who's, my dentist tells me I need to go every 3 months because I have so much saliva, which he says is a good thing, but at the same time it has a little negative effect of building up more blood, and thus it makes me coming more often, and I'm really not doing it. I go more like every 8 months instead every 2 to 3 months, like he tells me. So this conversation encourages me to go more often. I promise. I'm not kidding either. Bye-bye, Dr. Fenderson.